48-year-old woman with increasing breathlessness. CT scan of the chest showing the cause of increasing breathlessness. There are filling defects in both main pulmonary arteries. This is the filling defect within the right main pulmonary artery, and this is the filling defect within the left main pulmonary artery, indicating pulmonary embolism, pulmonary emboli. And if you go upwards, you will find that the main pulmonary artery diameter is similar to the ascending aorta diameter, which is abnormal. Normally, the main pulmonary artery diameter should be less than the ascending aorta diameter. So this means that the main pulmonary artery is dilated due to pulmonary hypertension, mostly due to the pulmonary emboli. Then, if you go downwards, this is the right ventricle and this is the right atrium. So let's talk about the normal. First, the normal appearance of the heart on CT scan before talking about these abnormal findings. This is the right ventricle, normal right ventricle, and this is the left ventricle, okay? Normally, the left ventricle wall thickness, is more or greater than the right ventricle wall thickness. The left ventricular diameter is also greater than the right ventricular diameter. Why? Because the left ventricle pressure is higher than the right ventricular pressure. The interventricular septum normally is curved with its concavity is towards the left ventricle. Why? Due to the left ventricular high pressure that causes concavity, a slight concavity of the interventricular septum. So here, can you see the difference between the right ventricular diameter and the left ventricular diameter? The right ventricular diameter here is greater than the left ventricular diameter, which is normally should be less than the left ventricular diameter. So the right ventricular diameter is greater than the left ventricular diameter. The right ventricular wall thickness is increased here, slightly increased compared to this one. Can you see this? The interventricular septum is curved with its concavity toward the right ventricle, which is the reverse of the normal. The concavity should be toward the left ventricle. However, here its concavity is toward the right ventricle. This means that the higher pressure now is within the right ventricle, not within the left ventricle. So this means that the right ventricle pressure is higher than the left ventricular pressure. This is called right ventricular strain. Right ventricular strain. Also, the right atrium is dilated here. Okay. If you go down to see the abdominal cuts, you will see that there is massive amount of ascites along with omental thickening and massive amount of ascites. The interpretation here, this patient has massive pulmonary embolism that caused pulmonary hypertension and right ventricular strain. This is associated with omental thickening and massive ascites. So the most likely diagnosis here is that this patient has primary malignancy, which is most likely to be ovarian or gynecological malignancy. Why? Because these malignancies is most likely to show omental deposits and malignant ascites. This malignancy is most likely to be associated with omental deposits and malignant ascites. Also, this primary malignancy is associated with hypercoagulable state, which is tumor associated. This hypercoagulable state is the cause of the development of the pulmonary emboli. Then the pulmonary emboli is the cause of increased pulmonary artery pressure and the right ventricular strain. So you can say that the diagnosis here is massive pulmonary embolism with right ventricular strain with a background of metastatic malignancy. So the management here, this patient needs more pathological investigations. This patient needs ultrasound guided biopsy of the omental deposits or aspiration of the malignant ascites for tissue diagnosis. This patient also needs more radiological investigations. He needs CT scan of the abdomen. CT scan of the abdomen, because the CT scan of the abdomen here is not complete. So he needs CT scan of the abdomen and the pelvis to look for the primary malignancy, especially the ovarian and gynecological malignancy, which is the cause of the malignant ascites and the omental deposits. And also the cause of the hypercoagulable state and the development of the pulmonary emboli. This patient also needs to be referred urgently to the respiratory clinic for starting treatment of the pulmonary emboli probably by the thrombolytic therapy. So he needs urgent referral to chest clinic for starting the thrombolytic therapy. And also he needs to be referred for oncology for further evaluation of the primary malignancy and the malignant ascites and the omental thickening. So that's it.